Anti-Inflammatory Diet for Arthritis, Full Guide. Hey everyone, welcome back. If you're dealing with arthritis, you know that stiff, achy feeling, especially first thing in the morning or after sitting still for too long. It can feel like your joints just don't want to cooperate. Here's the thing though, the instinct to rest and protect that joint often makes things worse, not better. Movement, specifically gentle, consistent stretching, is one of the most effective tools we have for managing arthritis pain. In this video, I'm going to walk you through the best stretches for the areas arthritis affects most: your neck, shoulders, hands, hips, knees, and ankles. I'll also cover a few ground rules to keep you safe while you do them. Let's get into it. First, a quick word on why this actually works. Arthritis causes inflammation and stiffness in your joints. And when a joint hurts, the natural response is to move it less. But less movement means the muscles around that joint get weaker, the joint itself gets stiffer, and cartilage doesn't get the nutrients it needs from normal movement. It's a cycle. Pain leads to less movement, and less movement leads to more pain. Stretching breaks that cycle. It helps lubricate the joint, maintains your range of motion, keeps the surrounding muscles strong and supportive, and can even improve your balance and posture. Research consistently shows that people with arthritis who stay gently active have less pain and better function than those who don't. So this isn't about pushing through pain. It's about giving your joints the movement they need to stay as healthy as possible. Before we get into the stretches themselves, a few important guidelines. Number 1, warm up first. A short walk or even a warm shower helps loosen things up before you stretch. Number 2, move slowly. No bouncing, no sudden movements. Ease into every position. Number 3, mild tension is fine. Sharp or shooting pain is not. If something hurts sharply, stop immediately. Number 4, hold each stretch for 15 to 30 seconds and breathe normally the whole time. Don't hold your breath. And number 5, consistency beats intensity. Doing a little bit every day will help you far more than one long session once a week. One more thing, if you have advanced joint damage, a recent surgery, or you're just not sure what's safe for you, check with your doctor or physical therapist before starting. Okay, let's get into the stretches. Let's start at the top with the neck. Arthritis here can cause stiffness and even headaches. First, the neck tilt. Sit or stand tall, shoulders relaxed. Slowly tilt your head toward one shoulder until you feel a gentle stretch on the opposite side. Hold for 15 to 20 seconds, then switch sides. Second, chin tucks. Sit tall and gently draw your chin straight back like you're making a double chin. Hold for 5 seconds, release, and repeat about 10 times. This one's great for counteracting that forward head posture a lot of us develop from looking at screens all day. Next, the shoulders. The cross-body stretch. Bring one arm across your chest at shoulder height and use your other arm to gently press it closer to your body. Hold 15 to 20 seconds, then switch arms. Then there's the doorway stretch. Stand in a doorway with your forearms resting on either side of the frame, elbows bent at 90 degrees. Lean forward gently until you feel a stretch across your chest and shoulders. Hold for 20 to 30 seconds. This one's especially helpful if your shoulders feel tight from rounded posture. Now let's talk about the hands and wrists. Since arthritis often hits these small joints hard and can make everyday tasks like opening jars or typing really difficult. First, fist to fan. Make a loose fist. Then slowly open your hand and spread your fingers as wide as you can like a fan. Repeat about 10 times per hand. Second, the wrist flexor stretch. Extend one arm in front of you, palm facing up. With your other hand, gently pull your fingers back towards you until you feel a stretch through your forearm and wrist. Hold 15 to 20 seconds, then switch hands, moving down to the hips. Seated hip marches. Sit tall in a sturdy chair and lift one knee up toward your chest as high as is comfortable, then lower it. Alternate legs for 10 to 15 reps each side. This keeps the hip joint mobile without putting a lot of stress on it. Then the figure 4 stretch. Lie on your back with your knees bent and cross one ankle over the opposite knee. Gently pull the uncrossed thigh toward your chest until you feel a stretch in the hip of the crossed leg. Hold 20 to 30 seconds, then switch sides. For the knees, we want to focus on the muscles that support the joint, the hamstrings and quads. Seated hamstring stretch. Sit on the edge of a chair with one leg extended straight out and your heel on the floor. Keeping your back straight, Hinge slightly forward from your hips until you feel a stretch behind your thigh. Hold 15 to 20 seconds. Then switch legs. Quad stretch with support. Stand holding onto a wall or chair for balance. Bend one knee and bring your heel toward your glutes, holding your ankle gently, knees close together. Hold 15 to 20 seconds. Then switch sides. And finally, the ankles and feet. Ankle circles. While seated, lift one foot slightly off the ground and slowly rotate your ankle in circles, 10 times in each direction, then switch feet. Calf stretch. Stand facing a wall with your hands pressed against it. Step one foot back, keeping that heel on the ground and the leg straight. Lean forward gently until you feel a stretch in your calf. Hold 20 to 30 seconds, then switch legs. So that's a full routine covering the neck, shoulders, hands, hips, knees, and ankles, the areas arthritis affects most often. A few final thoughts. If you can, try stretching in warm water, like a heated pool. It takes pressure off the joints and can make movement more comfortable. Pairing these stretches with some light strength work, like resistance bands, will support your joints even more. And practices like yoga or Tai Chi are worth exploring too, since they combine slow, controlled movement with stretching in a really joint-friendly way. If you try this routine and your stiffness isn't improving, or if you notice swelling, redness, or warmth around a joint, that's your cue to check in with a doctor or physical therapist. They can build a plan that's specific to your type of arthritis and your needs. Thanks so much for watching. If this was helpful, give it a like, subscribe for more health and wellness content, and I'll see you in the next video.